Hi, my name is Dr. Karen Liao. I am the Associate Program Director of University of Illinois Family Medicine Residency Program in Rockford. It is my pleasure to present this video abstract of our recently published paper from American Journal of Public Health titled Lessons Learned in Building a Primary Care Training Program in Advanced Surgical Obstetrics, Implementation of Stretch OB. Stretch OB stands for Structured Training for Rural Enhancement of Community Health and Obstetrics. This is a track within our Family Medicine Residency program. Today, I am accompanied by Dr. Lilian Ameh, who had just graduated from Stretch OB track in June 2024.
Hi, I'm Lilian Ameh.
The background of creating the surgical obstetric track to train family medicine physicians is to help to create workforce to address rural maternal and fetal health. Study shows women living in rural area faces barriers to finding and receiving maternity care. The two major reasons are, first, rural hospitals that could provide obstetric care are closing in an alarming rate. More than half of rural counties do not have hospitals that provide obstetric services. The second problem is the shortage of providers that can provide obstetric care in rural area. These reasons cause increased mortality rate of women and newborn dying from pregnancy-related complications. Looking at Illinois, there are 93 rural counties designated as medically underserved areas, but only 23 have hospitals offering OB care. 16 rural hospitals have closed their labor and delivery unit in the past 15 years. Only 6 out of the 51 critical access hospitals in Illinois have a labor and delivery unit. Pregnancy-related mortality rate was highest at rural counties and lowest around Cook County, which includes Chicago and the surrounding cities. Stretch OB track is a track within our Family Medicine Residency program. The residency itself is an unopposed training program. Our residents receive inpatient and obstetric training in our affiliated hospital, UW Health, Northern Illinois, Swedish American Hospital. The hospital has about 3,200 deliveries per year. Residents' outpatient continuity training site is at UI Health Miles Square LP Johnson Clinic, which is a federally qualified health center. The residency has strong existing relationship with rural community partners in graduate medical education and in research. We created and launched the Stretch OB track in 2021 as the advanced high-risk and surgical obstetric training track within our residency program for residents who are interested in providing high-risk and surgical OB care in rural and underserved community after they finish residency training with us. Residents are trained by our family medicine faculties who provides OB care and by the obstetricians in our community. The Stretch OB curriculum includes prenatal care, inpatient antepartum and postpartum care, normal and abnormal labor, identified and stabilized preterm labor, preterm delivery and manage high-risk OB complications like hypertension disorders in pregnancy, diabetes and gestational diabetes, operated vaginal delivery, and C-section and its complications. Surgical and procedure training required case exposure. Stretch OB residents receive their inpatient training at UW Health Northern Illinois Swedish American Hospital at Rockford. They receive outpatient continuity care and prenatal care training at UI Health Miles Square LP Johnson Clinic at Rockford. Rockford is a suburb city. In order to help residents connect their training with rural practice, they will spend at least 2 months in rural communities to work with our rural partners as family medicine residents providing OB care. Currently, we have 6 rural rotation sites for Stretch OB residents to do their rural rotations. 5 of them are in Illinois and 1 in Iowa. 3 out of the 6 hospitals are critical access hospitals that only have family medicine physicians providing OB care and performing C-sections. The other 3 hospitals have family medicine physicians collaborating with OB/GYN to provide OB care. The purpose of this rural rotation is for our residents to gain good understandings of full-scope family medicine practice in rural communities. Stretch OB residents need to do at least 2 one-month core rural rotations, one in their 2nd year of training and the other one in their 3rd year of training. They have an additional OB/GYN rotation in rural area. With these core rural rotations, Stretch OB residents will learn how to practice in rural setting as a primary care physician providing high-risk OB care with limited resources. We created milestones to help assess Stretch OB residents' skills and knowledge. As PGY2, they will need to be proficient in fetal heart tracing interpretation, artificially rupture of membrane, and place internal monitoring devices like fetal scalp electrodes and intrauterine pressure catheter. They will be proficient in cervical exam and cervical ripening Cook balloon insertion, as well as 1st and 2nd degree perineal laceration repair. By the end of PGY3, they should be proficient in managing low-risk and high-risk prenatal care, spontaneous vaginal delivery, managing normal and abnormal labor, performing C-sections and operative vaginal delivery, 3rd and 4th degree laceration repair, managing shoulder dystocia, postpartum hemorrhage, and hypertension disorders in pregnancies. Next, I will have Dr. Lilian Ameh share resident number, preceptor, and resident interview results.
Prior to graduating from our residency, Stretch OB residents are anticipated to have at least 100 vaginal deliveries, to complete a minimum of 50 C-sections as first assist surgeons, and have additional 20 C-sections as primary surgeons. The cumulative procedure number for our first 2 graduates are listed in the slide. They joined Stretch OB track from 2021 and graduated in 2023. In total, they obtained 164 vaginal deliveries, 161 C-sections as primary surgeon, and 153 C-sections as first assist surgeons. I just graduated from the program June of 2024 with 116 vaginal deliveries, 27 primary C-sections, and 65 first assist C-sections. After graduation, I'll be working at the Critical Access Hospital, providing family medicine with surgical obstetric care. We wanted to obtain qualitative data from residents and preceptors, so we conducted an initial resident and preceptor participant interview in October of 2021 to obtain baseline information. We now repeat this interview annually to facilitate improvement of the program. The preceptor survey showed that our preceptors did not think precepting Stretch OB residents caused increased workload. About half of the preceptors reported reduced workload having a Stretch resident working with them. However, a small number of preceptors did report challenges working with Stretch OB residents. From the annual interviews, residents expressed positive experience with the high-risk obstetric training opportunities. The Stretch OB residents have created trust with physician preceptors and labor and delivery nursing staff that they're actually expecting the Stretch OB residents' involvement in all patient care. There are some concerns about having less dedicated time for the family medicine core training due to the residents wanting to gain more opportunities to learn high-risk OB. Because of that, our residents requested schedule redesign so that workflow and continuity of care does not get interrupted due to their rotation and outpatient training requirements. After having their rural rotations, residents are also requesting more experience in neonatal resuscitation and management to prepare for rural practice.
In summary, we find that Stretch OB track integrates well within the UIC Rockford campus mission of serving the rural and underserved communities. It gives us an opportunity to address a larger need for OB care in rural areas. Stretch OB also provides a good, unique opportunity to work closely with our rural partners. We still face challenges in recruitment, scheduling logistics, and evaluation of Stretch OB clinical competencies. We continue to work with current residents, alumni, and preceptors to adapt and improve the program. In the end, I would like to acknowledge our team contributing in supporting Stretch OB track. I would like to acknowledge HRSA's support. This program was funded by HRSA since 2020. Thank you for your time and attention for this video abstract. I will direct you to the full paper on the American Journal of Public Health website. Thank you.